At the outset, I wish to convey on behalf of the Prime Minister, the Honourable Mia Amor-Motley, the government and the people of Barbados, a heartfelt welcome to all stakeholders present today, whether in person or virtually, at this small island developing state's high-level technical meeting on NCDs and mental health. I extend a special welcome to all of you who have traveled to Barbados for this meeting, and it is my hope that your visit allows for you to participate in some of the attractions my island has to offer, and not only the walk that has been organized by Dr. Hennis. Of course, I also want to extend my sincere gratitude to the World Health Organization and the Pan American Health Organization for allowing the Ministry of Health and Wellness of Barbados the opportunity to co-host this important meeting. Today's forum, and indeed the next 2 days, provides a safe space where you, high-level technical representatives, can collectively share our challenges in relation to NCDs and mental health, and also share a platform for the exchange of experiences. These challenges resonate on the international agenda and undermine socioeconomic development throughout the world, threatening the achievement of the Sustainable Development Goals. For small island developing states, the impact is far-reaching and can redound to the erosion of development gains at both national and regional levels, with a high burden of ill health and disease and their attendant costs. The disruptions of our health systems during the COVID-19 pandemic, having further exacerbated this impact, now mandates the need for multi-sectoral approaches to our unique human and social challenges. Indeed, it is this very uniqueness that allows us as small island developing states the opportunity to lead the charge in the global arena and to articulate an agenda which provides the necessary leadership required to overcome what is possibly the greatest public health challenge of our time. The 1994 Program of Action for Sustainable Development SIDS meeting in Barbados first recognized this grouping of countries as requiring special attention by the global community. Today's meeting, nearly 30 years later, focuses on minimizing the impact of NCDs, mental health, and climate change on sustainable development. Ladies and gentlemen, small island development states have played a leadership role in influencing the global development agenda. The Caribbean community, CARICOM, first recognized NCDs as a threat to national and regional development and established a regional commitment to address this major public health issue. CARICOM hosted the world's first ever summit of heads of government on NCD prevention and control and issued the landmark Declaration of Port-au-Spain in 2007. This summit galvanized several global events leading to the first United Nations high-level meeting on NCDs in 2011. In 2014, the SIDS Accelerated Modalities of Action, better known as the Samoa Pathway, included a commitment to, and I quote, enable cooperation among small island development states on diseases by using existing international and regional fora to convene joint biennial meetings of ministers of health and other relevant sectors to respond in particular to NCDs, end of quote. This meeting is intended to be a continuation of these discussions and those held last year in the WHO SIDS Summit for Health, where it was recognized that SIDS nations face acute and existential health and development threats. It is unfortunate that small islands developing states share a disproportionately high burden of the risk factors, morbidity, and premature mortality caused by non-communicable diseases, mental health conditions, and their determinants. We are a distinct group of countries that face common threats due to our geography and remoteness. SIDS often rely on other countries to produce essential goods and are characterized by a higher burden of specific vulnerabilities, including 1, lower human, financial, and medical resources in the health system, impacting our capacities to respond to non-communicable diseases and mental health. 2, a higher prevalence of NCDs, poor mental health and their risk factors. 3, outbreaks from new and re-emerging communicable diseases. And 4, present and future threats from climate change, which as we know, is mainly caused by non-SIDS. Indeed, 52% of people with NCDs in SIDS countries are dying prematurely, and with risk factors showing that 28% of adults aged 18 and above do not engage in enough physical activity, 23% smoke tobacco, and 56% are overweight, with half of these being obese. In addition, the Global Burden of Disease report of 2019 estimated that 15.2% of Caribbean population had a mental disorder needing intervention, and that was 2019, pre-COVID. So while court circumstances vary in SIDS countries, there are commonalities in key vulnerabilities. We note that overall life expectancy in SIDS is in line with global averages. However, the life expectancy in and among SIDS countries can vary by as much as 20 years. Additionally, as we heard earlier, in SIDS countries, suicide rates are disproportionately high relative to global averages, and childhood obesity remains on the incline, particularly in the Western Pacific region. To combat these issues, it is clear that multisectoral and whole-of-government approaches are required, especially for action on the environmental, economic, social, and commercial determinants of health. These approaches can also help support the work of the WHO Global NCD Compact and the heads of state of government group for the prevention of NCDs, in which SIDS countries have had a leading role, specifically with the participation from governments of Mauritius, Samoa, Tonga, and Barbados. Ladies and gentlemen, the unique vulnerabilities faced by SIDS also affect the performance of primary health care systems and hinder progress towards achieving universal health coverage. Remote geographies, small populations, scarce resources, dependence on international trade and foreign aid, and the effects of climate change make it challenging for our countries to transition to resilient and sustainable health systems. A lack of adequate health facilities, health workforce shortages, including those primarily due to migration, health information data gaps, and inappropriate access to medicines, vaccines, and health products, further accentuated by complex procurement mechanisms, typify the SIDS experience. In these circumstances, the often fragmented and poorly accessible healthcare services threaten people living with NCDs and mental health conditions in our countries. Clearly, structural inequities produce health inequities through social, environmental, economic, and cultural determinants of health. Commercial determinants of health and trade are also important drivers of NCDs in SIDS, and I believe the commercial determinants of health are defined as private sector activities that affect people's health both positively or negatively. However, underpinning the commercial determinants of health is an understanding that large multinational companies can exercise broad influences on the economic, physical, social, and cultural environments in which our people live. In fact, through their influence on food prices, availability, and advertising, trade arrangements, and policies, they have accelerated the national shift away from traditional diets, resulting in increased levels of obesity, food insecurity, and of course, rising NCD incidence. Sometimes, due to the size and nature of the commercial actors involved, governments in SIDS face impossible odds in securing regulatory protection to improve health. This is particularly true where governments' resources and budgets may be dwarfed by the size and scale of the multinational companies, state-owned enterprises, and foreign commercial actors. Collectively, these entities are associated with climate change, worsened nutritional environments, increased NCD incidents, and greater social and economic burden on already underfunded and fragile health systems. With health, it is imperative to examine the role of commercial actors, understanding these commercial determinants of health, the power balances inherent within them, and the critical role of global governance is an important stop in supporting SIDS to improve health outcomes in these circumstances. Food labeling, taxes on unhealthy foods, campaigns to limit the amount of sugar in drinks, and food train incentives are just some of the regional initiatives that the Caribbean SIDS have launched to combat NCDs in the face of these commercial determinants. Indeed, Barbados has identified this challenge and is looking to ensure that policies to remove industrially produced trans fat from the food system are in place by December 2024. Similar considerations were encountered in introducing the local school nutrition policy and the adoption of the sugar-sweetened beverage tax. Ladies and gentlemen, the COVID pandemic has been the single most impactful event across the globe for just over 3 years. The increased prevalence of NCDs and SIDS made our population more susceptible to developing more severe COVID-19 illnesses, coupled with the fact that obesity increases the severity and mortality of COVID-19. Two additional issues also come into focus, and these are the economic impact and the inequities that were created during this time. Vaccines, pharmaceuticals, and other medical devices were often unavailable as efforts of solidarity were challenged. In addition, COVID-19 had a tremendous economic impact, especially on tourism-dependent economies, as many SIDS are, and this in turn has had an enormous impact on NCDs and mental health. The impact on national income generated from tourism has presented a fundamental challenge to SIDS governments and communities, and this impact is likely to fall disproportionately on low-income and seasonal workers, including young workers, and concomitantly unemployment, reduced wages, housing challenges, and increased food security become inextricably linked to adverse mental and physical health consequences. The challenges that SIDS face in relation to the economic and commercial determinants of health, already mentioned, are further compounded by the ever-present existential threat of climate change. Any notion of sustainable development in SIDS is threatened by the effects of sea level rise, extreme weather, and air pollution. Climate-induced displacement of small island communities is a key challenge, with socioeconomic and human insecurity implications for SIDS. The impact of living with climate change on mental health and well-being remains an unappreciated and under-researched issue. Some of you may be aware of the devastating impacts of hurricanes on the countries of the Caribbean region. The recent destruction due to weather systems in our region, including Hurricanes Maria and Dorian, has collectively set back the development of several member states, collectively by over 100 years. This SIDS meeting now provides the opportunity for technical and scientific staff to deliberate and make recommendations to the ministerial meeting to be held here in Barbados in June, and ultimately to have the outputs of these two meetings feed the international agenda for NCDs. A key pillar of the efforts of the international community has been to support SIDS through bilateral and multilateral aid programs. This is needed now more than ever, especially to strengthen NCD and mental health programs in this post-COVID period. The international community must also ensure that the lessons of COVID-19 and the knowledge of the role of social and commercial determinants of health and unique vulnerability of SIDS are taken into consideration for increased donor support and technical cooperation. Indeed, the global community has committed to strengthen implementation of primary health care and build more equitable and resilient health systems to deliver quality, safe, comprehensive, accessible, and affordable health care to everyone. Countries have reiterated this pledge through the Declaration of Astana, with a clear commitment for SIDS to address NCDs and mental health through primary health care and to promote progress towards universal health coverage. Assistance can be provided to reorient health systems through strengthened governance, access to health products, a well-trained workforce, financing, information and service delivery, while enabling effective development cooperation, especially including South-South collaboration. With the support of the international community, greater policy coherence and coordination and synergistic action to address the NCDs and mental health can be achieved through multi-sectoral coordination, partnerships, engaging multiple stakeholders, and of course, involving people with lived experiences. Small island states have a history of dealing with outsized challenges, shaping solutions, and influencing the world agenda to advance development. We have identified the issues and drivers while committing to action, mobilizing resources, and collaborating with non-traditional partners. There continues to be potential for action to not just be based on available financial resources, but for actions to be based on rethinking the issues and addressing the true determinants of the problems. In these circumstances, the cost of not taking action will be significant across all social and financial domains. The timelines of this event cannot be underscored, as we seek now to move from solely a COVID focus and address the associated loss of pace in progress in implementing policies and programs for the effective control of NCDs. We must critically examine the initiatives that address NCDs and that have the potential to positively impact and improve the health and well-being of our citizens. As we engage in these 2 days of technical discussions, I would like us to reflect on the fact that for small island development states, we can ill afford to fail in addressing NCDs. It is absolutely imperative that we now tackle NCDs through accelerating effective actions. Ladies and gentlemen, in closing, I wish to applaud WHO and fellow SIDS countries for their resolute commitment to the NCD and mental health agenda. I look forward to the outcomes of this meeting and your contribution to shaping and advancing the agenda for meaningful progress. I wish you a productive meeting, good health, wellness, and God's blessings. I thank you all.